So, good morning everyone. I'm going to perform cleansing feeding bath. So, first, going to separate the parts of the bottle. So, cup, the bottle, the ring, and the nipple or tip. And also the tongue and the leveling knife. So, put some water, then wash, then throw, put some water, wash, and throw, and put some water, and put a dishwashing soap, and make a lather. Then for the bottle, use a big brush. So for the groove, use a small brush. And for the tongue, use a small brush, labeling knife, the cup, and the ring. And for the nipple, put some small amount of water and squirt it to get the milk curd. Then throw the water and put some water again. And then rinse. Throw, put some water and rinse. Throw and put some water. And throw. So now I'm going to sterilize the feeding buckets. So put some water into the container, half of water, then put the bottles upside down, the tongue and the leveling knife, and the ring and the then turn on. So we will have to wait 20 to 25 minutes at the boiling point. So turn off, upside down, then put the nipple. So again we have to wait 5 minutes. Then after 5 minutes, let it cool. So cool. So get the tongue. So first get the leveling knife, so the ring, the nipple, and the cup. So now I'm going to prepare the milk formula. So put a mineral water or distilled water, 60 ml. So which is the formula is 2:1, and milk, which is 1 scoop. So use a leveling knife to label. Then the exist of milk. Then put. Then close. So in shaking the milk, it should be palm to palm and circular motion. So don't shake like this so that you can avoid abdominal pain. So now I'm going to perform infant bath. So first we have to check the baby's temperature. So in checking the temperature of the baby, you have to use a tympanic temperature. So check the ears of the baby. So the temperature of the baby is normal. So now I'm going to check the materials. So the materials are completed. So we have to put a towel under the tub to avoid slipping. And put a warm water to the tub. 1/2 of water. And also to the basin. So pour half of water. So check the water using your wrist or the inner forearm. So it's okay. So next is put something soft to the table and get the baby. So you have to lift the baby. You have to slowly, be gentle. So get the materials for cleaning the face of the baby. So first I'm going to clean the eye of the baby. So using forceps, rinse first, then get the cotton balls. Then, so to clean the eyes of the baby, so you have to inner to outer canthus, the other side, inner to outer canthus, discard. Again, inner to outer canthus, other side, inner to outer canthus. This is the face. So start forehead to cheek, bridge of the nose, cheek, under the chin, behind the back of the ears, and squeeze to exist water and the penna. Discard. So next is forehead, chin under the nose, chin under the and behind the ears, and squeeze to exist water and penna. So next is remove the bead. Then expose the neck. Then clean using the cotton ball. So clean, discard, clean, discard. Then pat dry. So next, let's clean the baby's head. So we have to remove the cap. So we have to carry the baby into a football position. So in cleaning the baby's head, you have to flip the ears to avoid entering water. So wash, use your fingertips to massage and wash, and apply soap. Then rinse. So put the baby and do a pat dry. And put the baby's cap immediately to avoid congestion. So we have to expose only the lower part, lower extremities. So we have to remove the baby's diaper. So in cleaning the perineum of the baby, so we have to use the clean part of the diaper. So in the penis, rectum, gluteal fold, the other side again, the groin, the other side, groin, and then lift baby. Put the buttocks of the baby at the top of the diaper, which is clean. Pull the diaper to discard. So we have to remove the t-shirt of the baby and the pajamas, and also the mittens and the booties. So put a towel across the chest to avoid wetting. And next, we have to carry the baby into a reclining position. So, we have to clean the baby's body. So first, clean the neck, the shoulder, the chest, the abdomen, the arm, and pay attention to the axilla, and the hands, and pay attention in the fingers, in between fingers, then the perineum, the legs, and the foot, and pay attention in between toes. Then apply soap, then neck, shoulder, chest, abdomen, arm, hands, pay attention to the fingers, perineum, legs, groin, foot, and pay attention to the toes, and rings. And other side of the and the back. So first we have to wash the knuckle area, scapula, the back, the gluteal fold, the ischium, the leg, and the foot. Then apply soap, knuckle area, scapula, back, gluteal fold, ischium, leg, and foot, and wash. Then wrap the baby. Then pat dry. Then put the baby into the new flanella. Then cover first. Then put the diaper of the baby. So if the baby is female, the back of the diaper it should be, the front of the diaper it should be long. If the baby is male, the back should be long. Put the baby's shirt. So before dressing the baby, so we have to clean the nose. So use a slightly moist cotton buds. So clean. Use the other side, clean. Discard, clean, and the other side, clean. And for the ears, use a dry cotton buds, penna, the other side, penna, discard, and the penna, and the other side, penna. So expose the umbilicus of the baby. So to clean the umbilicus of the baby, you have to get first a cotton ball. So rinse, get the cotton ball. Then pour a alcohol and to dry your hands. Then to clean the umbilicus, you have to start in the center. So inner to outer, discard, inner to outer, discard, inner to outer, discard. So now I'm going to dress the baby. Pajamas. And also the mittens. it should be in the wrong side to avoid cutting fingernails. So, the other hand. And also the booties, it should be in the wrong side. So, you have to tie the mittens. The other mittens. Then, wrap the baby into swaddle. And the baby. So now I'm going to feed the baby. So first you have to put a burping towel to your shoulder. So the caregiver must be sitting down while feeding the baby, and the baby should be in semi-reclining position. So now I'm going to feed the baby. So first you have to check the temperature of the baby, of the milk formula, in the wrist. So you have to feed the baby. So rooting reflex, when the baby's mouth is open, insert the nipple and let it flow the milk. And rooting reflex again, put to the baby's mouth, side of the baby's mouth, and then when the baby's mouth is open, then pull the nipple. Then cover immediately the feeding bottle. So imagine that it has a cup, and then wipe the excess water by using the bead. So now we have to burp the baby. So there are different ways to burping. So first is shoulder burp, the second is sitting down burp, and last is prone or lap burp. So first is the shoulder burp. So the shoulder burp, so the baby's abdomen should be against the shoulder. And do back massage and observe the baby. If the baby has a blue discoloration or having a difficulty of breathing. And the second one is sitting down burp. So you have to place the burping towel at the crook of your arm. So you have to place to the abdomen of the baby and then apply force, and then do a back massage of the baby. Massage the back and observe the baby if the baby has a bluish discoloration or having a difficulty of breathing. And next is the prone or lap burping. So the towel placed to the other crook arm, and then the baby should be the baby's abdomen should be against the lap or the thigh. So I'm going to like that. So, massage the back and observe the baby if the baby has a bluish discoloration or having a difficulty of breathing. So now I'm done with the burping of the baby. So now, before putting the baby into the crib, we have to check the diaper of the baby if the baby having a defecate or not. So the baby is not defecating, and then check the crib if there's a sharp objects or insects, and avoid many pillows because the baby will suffocate if there's a lot of pillows. So now place the baby. So the crib, it should be in the semi-reclining position. So imagine. And raise the side rails and lock for the safety of the baby. So I'm done in the infant care.